Hi everyone, welcome back to Health, Fitness and Nutrition, the channel where we share tips and advice on how to live a healthy and happy life. In today's video, we're going to talk about the top 10 foods to eat when you are pregnant. Pregnancy is a special time in your life, and you want to make sure you and your baby get all the nutrients you need for a healthy development. But with so many food choices out there, how do you know what's best for you and your baby? Well, don't worry, we've got you covered. Here are 10 super nutritious foods that you should include in your pregnancy diet. 1. Dairy products. Dairy products are rich in protein, calcium, phosphorus, B vitamins, magnesium, and zinc. These are all essential for your baby's growth and development, especially for their bones and teeth. Dairy products also contain probiotics, which are beneficial bacteria that support your digestive health and immune system. You can get dairy products from milk, cheese, yogurt, and kefir. Try to choose low-fat or fat-free options to limit your intake of saturated fat. 2. Legumes. Legumes are plant-based foods that include beans, lentils, peas, chickpeas, soybeans, and peanuts. They are great sources of fiber, protein, iron, folate, and calcium. Fiber can help prevent constipation and hemorrhoids, which are common during pregnancy. Protein is important for your baby's growth and tissue repair. Iron is needed for your blood production and to prevent anemia. Folate is crucial for your baby's brain and spinal cord development and to prevent birth defects. Calcium is vital for your baby's bones and teeth. 3. Sweet potatoes. Sweet potatoes are delicious and versatile vegetables that are high in beta-carotene, a plant compound that your body converts into vitamin A. This vitamin is important for your baby's vision, skin, and immune system development. Sweet potatoes also provide fiber, vitamin C, potassium, and iron. You can bake them, mash them, roast them, or make them into fries or chips. 4. Salmon. Salmon is a fatty fish that is rich in omega-3 fatty acids, which are essential for your baby's brain and eye development. Omega-3 fatty acids may also improve your mood and lower your risk of preterm birth and postpartum depression. Salmon also provides protein and vitamin D, which are important for your baby's bones and teeth. Salmon is a low-mercury fish that you can safely eat up to 12 ounces per week. 5. Eggs. Eggs are one of the most complete foods you can eat during pregnancy. They contain high-quality protein, choline, iron, zinc, iodine, selenium, and B vitamins. Protein is essential for your baby's growth and development. Choline helps your baby's brain and spinal cord development and prevents birth defects. Iron supports your blood production and prevents anemia. Zinc supports your immune system and wound healing. Iodine is important for your thyroid function and your baby's brain development. Selenium is an antioxidant that protects your cells from damage. 6. Leafy greens. Leafy greens such as spinach, kale, and Swiss chard are packed with essential nutrients for pregnant women. These vegetables are excellent sources of folate, which is crucial for the early development of your baby's neural tube and can help prevent birth defects. They also contain a variety of vitamins and minerals, including vitamin C, vitamin K, calcium, and iron. Vitamin C aids in the absorption of iron and supports your immune system. Vitamin K is essential for blood clotting and bone health. Calcium is crucial for the development of your baby's bones and teeth, while iron helps prevent anemia and supports your blood production. 7. Berries. Berries such as strawberries, blueberries, raspberries, and blackberries are not only delicious, but also highly nutritious for pregnant women. They are packed with antioxidants, fiber, and various vitamins and minerals. Antioxidants help protect your cells from damage and support overall health. Fiber aids in digestion and helps prevent constipation. Berries are also rich in vitamin C, which is important for your immune system and the absorption of iron. Including a variety of berries in your diet can add a burst of flavor and nutrition to your meals and snacks. 8. Lean meats. Lean meats, such as chicken, turkey, and lean beef, are excellent sources of high-quality protein. Protein is essential for the growth and development of your baby's cells, tissues, and organs. It also supports your own body's changes during pregnancy. Lean meats are also rich in iron, zinc, and B vitamins. Iron is crucial for the production of red blood cells and the prevention of iron deficiency anemia. Zinc supports your immune system and wound healing, while B vitamins play various roles in your body, including energy production and nerve function. 9. Whole grains. Whole grains, including whole wheat, oats, brown rice, quinoa, and barley, are nutritious choices for pregnant women. They provide complex carbohydrates, fiber, and a range of vitamins and minerals. Complex carbohydrates provide a steady release of energy and help you feel fuller for longer. Fiber aids in digestion, prevents constipation, and supports overall gut health. Whole grains also contain B vitamins, such as folate and thiamine, which are important for your baby's development and your own energy metabolism. Choosing whole grain options over refined grains can provide more nutrients and promote better blood sugar control. 10. Avocados. Avocados are not only creamy and delicious, but also highly nutritious for pregnant women. They are rich in healthy fats, including monounsaturated fats, which are beneficial for your baby's brain development. Avocados also provide fiber, folate, potassium, vitamin K, vitamin E, and vitamin C. Incorporating these top 10 foods into your pregnancy diet can help ensure that you and your baby are getting the essential nutrients needed for a healthy and happy pregnancy. Remember to always consult with your healthcare provider or a registered dietitian for personalized guidance and recommendations based on your individual needs. Stay tuned for more health, fitness, and nutrition tips on our channel, and don't forget to like and subscribe for future updates. Thank you for watching. Hello and welcome to Health, Fitness and Nutrition, the channel where we share tips and tricks to help you live a healthier and happier life. In today's video, we're going to talk about how to purify and detox your lungs naturally. The lungs are vital organs that allow us to breathe and exchange oxygen and carbon dioxide with the blood. They also filter out harmful substances from the air we inhale, such as dust, pollen, smoke, and pollutants. However, over time, these substances can accumulate in the lungs and cause damage, inflammation, and respiratory problems. Fortunately, there are some natural ways to cleanse your lungs and improve their function. Here are some of the methods you can try at home. 1. Steam therapy. Steam therapy is a natural and effective way to treat respiratory problems and purify your lungs. It works by using water vapor to open up the airways and loosen the mucus in the lungs, making it easier to breathe and expel the mucus. Steam therapy can also help to soothe and moisturize the irritated tissues in the lungs, reducing inflammation and promoting healing. One of the easiest ways to do steam therapy is by using a humidifier. A humidifier is a device that adds moisture to the air, which can help to alleviate respiratory problems caused by dry air. You can add some drops of essential oils, such as eucalyptus, peppermint, or lavender, to the water in the humidifier to enhance the benefits of steam therapy. Another way to do steam therapy is by using a steamer. A steamer is a device that produces steam, which you can inhale directly to open up your airways and loosen the mucus in your lungs. You can also add essential oils to the water in the steamer to enhance the benefits of the therapy. If you do not have a humidifier or steamer, you can still do steam therapy by simply boiling some water in a pot and breathing in the steam. To get the most out of this method, you can cover your head with a towel or blanket to create a tent over the pot, making sure to keep a safe distance from the hot water to avoid burns. When using steam therapy, it is important to be cautious and avoid getting burned. Do not place your face too close to the steam or hot water, and make sure to keep a safe distance. Also, be mindful of the temperature and duration of the therapy, as prolonged exposure to steam can cause damage to your skin and lungs. 2. Controlled coughing. Controlled coughing is a technique that can be helpful for individuals with lung conditions such as chronic obstructive pulmonary disease, COPD, bronchitis, or pneumonia. Coughing is the body's natural way of expelling mucus and other irritants from the airways, but not all coughs are productive. Controlled coughing is a technique that helps individuals cough more effectively and reduce chest congestion. To practice controlled coughing, you can start by sitting on a chair with your feet on the floor and leaning forward slightly. Place your hands on your stomach, just above your waistline, and take a deep breath through your nose. Then, slowly exhale through your mouth while making a low-pitched huff sound. This helps to activate the muscles in your stomach and diaphragm, which can help to expel mucus from your lungs. Next, take another deep breath through your nose, and this time, hold it for 3 to 4 seconds. Then, with your mouth open, cough forcefully to bring up the mucus. Make sure to direct the cough upwards, towards your mouth, rather than downwards, towards your chest. This can help to prevent further irritation or damage to your airways. Repeat this process several times until you feel that the mucus is moving up your throat and you are able to cough it up effectively. Remember to take breaks between coughing to rest and catch your breath. 3. Breathing exercises. Breathing exercises are an effective way to strengthen your lungs and improve your respiratory health. By practicing breathing exercises regularly, you can increase your lung capacity, improve your breathing efficiency, and enhance oxygen delivery to your body's cells and tissues. One of the most popular breathing exercises is diaphragmatic breathing, also known as belly breathing. This technique involves inhaling deeply through your nose and expanding your belly, then exhaling slowly through your mouth and contracting your belly. This technique allows you to use your diaphragm effectively, which can help you take deeper breaths and increase your lung capacity. Another effective breathing exercise is pursed lip breathing. This technique involves inhaling deeply through your nose and exhaling slowly through pursed lips, as if you are blowing out a candle. This technique can help to slow down your breathing and improve your breathing efficiency, reducing shortness of breath and improving oxygen delivery to your body. Alternate nostril breathing is another effective technique that involves alternating between breathing through your left and right nostrils. This technique can help to balance the flow of oxygen and carbon dioxide in your body, reducing stress and improving respiratory function. Using a spirometer is a device that can help you measure and improve your lung function. A spirometer is a small, handheld device that measures the amount of air you inhale and exhale and how quickly you can do so. By using a spirometer regularly, you can track your lung function and progress over time, and adjust your breathing exercises accordingly. 4. Percussion. Percussion is a technique that can be used to help clear mucus from the lungs. This method is commonly used to treat respiratory conditions such as bronchitis, pneumonia, and cystic fibrosis. It involves creating vibrations in the chest to help dislodge mucus from the walls of the lungs. To perform percussion, you will need someone to help you. You should lie down on a bed or a couch with your head slightly elevated. The person performing the percussion should then tap your back firmly but gently with their hands or a cupped device for about 5 minutes. The tapping should be done in a rhythmic manner, with a consistent force and frequency. After the back has been tapped, you should turn over and have the person tap your chest for another 5 minutes. This will help to loosen any mucus that may be stuck in the upper part of your lungs. The tapping should be done on the front and sides of the chest. It is recommended to perform percussion twice a day until you notice less mucus in your cough. This can take several days or even weeks, depending on the severity of your respiratory condition. It is important to note that percussion should not be performed if you have a broken rib or other chest injuries. 5. Diet changes. What you eat can also affect your lung health. Some foods can help reduce inflammation, boost immunity, and protect your lungs from damage. Some of these foods are garlic, onion, ginger, turmeric, honey, lemon, apple cider vinegar, green tea, berries, leafy greens, nuts, seeds, and oily fish. On the other hand, some foods can worsen your lung condition by increasing mucus production or triggering allergies or asthma attacks. Some of these foods are dairy products, eggs, processed foods, fried foods, fast food, and foods high in sugar or salt. Dairy products and eggs can increase mucus production, making it harder to breathe. Processed foods, fried foods, and fast food contain unhealthy fats that can cause inflammation and damage to your lungs over time. Foods high in sugar or salt can cause dehydration and worsen respiratory problems. It is important to be mindful of what you eat and try to include more lung-healthy foods in your diet while avoiding or limiting unhealthy foods. By doing so, you can improve your lung health and overall well-being. By incorporating these tips into your daily routine, you can improve your lung health and reduce your risk of respiratory problems. Don't forget to subscribe to our channel, Health, Fitness, and Nutrition, for more informative and engaging content on living a healthy lifestyle. Hello and welcome to Health, Fitness and Nutrition, the channel where we help you achieve your wellness goals. In this video, we are going to talk about how to learn anything fast. Whether you want to master a new skill, language, hobby, or subject, learning fast can save you time and energy. But how can you do it? Here are some tips and tricks that will boost your learning ability and make you a super learner. Tip number 1. Set a specific and realistic goal. Setting a specific and realistic goal is an essential step in any learning journey. When you have a clear idea of what you want to achieve and why, you provide yourself with a sense of purpose and direction. This tip emphasizes the importance of setting SMART goals: specific, measurable, achievable, relevant, and time-bound. Let's delve deeper into each aspect of the SMART criteria to understand how it contributes to effective goal setting. Specific. A specific goal is well-defined and clearly states what you want to accomplish. Instead of a general goal like, learn Spanish, a specific goal could be, have a 10-minute conversation with a native Spanish speaker in 3 months. By specifying exactly what you want to achieve, you create a concrete target to work towards. Measurable. A measurable goal allows you to track your progress and determine when you have achieved it. In the example of having a conversation with a native Spanish speaker, you can measure your progress by assessing your ability to hold a meaningful discussion within the specified time frame. Measuring your progress helps you stay motivated and provides a sense of accomplishment as you see yourself getting closer to your goal. Achievable. An achievable goal is one that is within your reach and aligned with your abilities and resources. It's important to set goals that challenge you but are still realistic. If you have no prior knowledge of Spanish, aiming to have a fluent conversation in 3 months may be overly ambitious. Instead, focusing on a specific duration of conversation with a native speaker can be more attainable and realistic within the given time frame. Relevant. A relevant goal is meaningful and aligns with your overall objectives. It's essential to consider why you want to learn Spanish and how it fits into your broader aspirations or interests. By understanding the relevance of your goal, you can stay motivated and committed to the learning process. Time-bound. A time-bound goal has a specific deadline or time frame for completion. Setting a deadline creates a sense of urgency and helps you structure your learning efforts effectively. In the example, the goal is to have a 10-minute conversation with a native speaker in 3 months. This time-bound aspect provides a timeline to work with and allows you to plan your learning activities accordingly. Tip number 2. Break down the skill into smaller chunks. Breaking down a complex skill into smaller chunks is a highly effective learning strategy because it allows you to focus on each part of the skill separately. By mastering each individual chunk, you can gradually build your knowledge and skills, which will enable you to learn the more complex aspects of the skill over time. For example, when learning to play the guitar, mastering a single chord or scale is a small yet significant accomplishment. This approach can help build confidence, create a sense of progress, and prevent the feeling of being overwhelmed. You can use the same method for any complex skill you want to learn, whether it's cooking, painting, or public speaking. The key is to identify the individual elements or sub-skills that make up the larger skill, then break them down into smaller, more manageable chunks. Once you have identified the chunks, you can prioritize them and decide which ones to focus on first. It is essential to give each chunk the attention it deserves by practicing it until you have mastered it before moving on to the next one. Taking a step-by-step approach not only helps you build your skills gradually but also enables you to track your progress more easily. Tip number 3. Use the Pareto Principle. The Pareto Principle, also known as the 80-20 rule, is a well-known concept in business and personal productivity. It suggests that 80% of the results come from 20% of the effort. This principle can be applied to many different aspects of life, including learning new skills. The Pareto Principle suggests that to become proficient at a skill, you don't need to learn everything there is to know about it. Instead, you should focus your efforts on the most important and useful aspects of the skill. By doing so, you can achieve the majority of the results with a relatively small amount of effort. For example, if you want to learn how to cook, you don't need to learn every recipe in the world. Instead, focus on mastering the basic techniques, ingredients, and tools that are essential for making a variety of dishes. By doing so, you'll be able to cook many different meals without having to learn every recipe. When applying the Pareto Principle, it's important to identify the most critical aspects of the skill you want to learn. These may include fundamental concepts, techniques, or tools that are necessary for achieving the desired results. Once you've identified these key elements, focus your learning efforts on mastering them. Another way to apply the Pareto Principle is to prioritize your learning. Instead of trying to learn everything at once, focus on the most critical elements first. Once you've mastered those, move on to the next most important aspects of the skill. Tip number 4. Use spaced repetition and active recall. Spaced repetition and active recall are two effective techniques that can help you retain and recall information more effectively. These techniques are based on the principle that learning is more effective when information is presented repeatedly over time, rather than in a single session. Here's how spaced repetition and active recall work. Spaced repetition involves reviewing information at gradually increasing intervals. When you first learn a piece of information, you might review it after a few hours, then again after a day, then a few days later, then a week later, and so on. The intervals between each review session are gradually lengthened as you become more proficient at recalling the information. By spacing out your review sessions in this way, you are more likely to retain the information in your long-term memory. Active recall involves actively retrieving information from your memory without looking at the source. For example, you might try to recall a list of vocabulary words from memory rather than simply rereading them from a textbook. This technique has been shown to improve memory retention and recall, as well as increase the speed and ease with which you can recall information. There are many tools and techniques you can use to incorporate spaced repetition and active recall into your learning routine. One popular method is to use flashcards, either physical or digital, that are designed to use spaced repetition and active recall algorithms. There are also numerous apps and software programs available that use these techniques to help you learn and retain information. Tip number 5. Apply what you learn. Applying what you learn in practical situations can help you solidify your understanding and skill set, and give you valuable feedback on your performance. For example, if you want to learn how to draw, you can start by practicing your skills by sketching objects around you. This will allow you to put into practice what you've learned, and also identify areas where you might need further improvement. Additionally, you can join online communities where you can share your work and receive feedback and critique from other artists. The benefits of applying what you learn are numerous. For one, it makes the learning process more enjoyable and rewarding. When you see the results of your efforts, it can give you a sense of accomplishment that can motivate you to keep learning. It also helps you internalize your new knowledge and skills more effectively by giving you a chance to see how they work in real-world situations. Furthermore, applying what you learn can help you identify gaps in your knowledge or areas where you need further improvement. This can help you to focus your learning efforts on areas where you need the most help, and ultimately become a more skilled practitioner in your chosen field. These are some of the tips and tricks that will help you learn anything fast. Of course, there are many more factors that influence your learning ability, such as your interest, motivation, attitude, environment, etc. But by following these tips, you will be able to accelerate your learning process and achieve your goals faster. We hope you enjoyed this video and learned something new today. If you did, please give it a thumbs up and share it with your friends. And don't forget to subscribe to Health, Fitness and Nutrition for more videos like this one. Thank you for watching and see you in the next video. Hello everyone, and welcome back to the Health, Fitness and Nutrition channel. Today, we're going to talk about something that affects every single one of us, our brains. Specifically, we're going to dive into habits that can boost your brain power and help you perform better in your daily life. Our brains are incredibly complex organs that control everything we do. They help us think, feel, move, and interact with the world around us. So it's no surprise that many of us are interested in finding ways to improve our brain function. Luckily, there are many habits that can help. 1. Exercise. Exercise is an essential habit for overall physical health and well-being. However, research has shown that it also has a profound impact on brain function and mental health. Some of the ways that exercise can improve brain function are: exercise increases blood flow to the brain. This increase in blood flow can help to improve cognitive function and memory. When you exercise, your heart rate increases, which helps to pump more blood to your brain. This increased blood flow delivers more oxygen and nutrients to your brain cells, which can help to improve their overall function. As a result, regular exercise has been linked to improved memory, attention, and executive function. Exercise has been shown to release chemicals called endorphins. Endorphins are neurotransmitters that act as natural painkillers and mood boosters. They are responsible for the feeling of euphoria that many people experience after a workout. Endorphins can also help to reduce stress and anxiety, which can have a profound impact on mental health. Regular exercise has been linked to reduced symptoms of depression and anxiety, as well as improved mood and self-esteem. In addition to these benefits, exercise has also been shown to promote the growth of new brain cells. This process is known as neurogenesis, and it occurs in the hippocampus, which is a region of the brain that is critical for memory and learning. Studies have shown that exercise can increase the production of a protein called brain-derived neurotrophic factor, BDNF, which is essential for the growth and survival of new brain cells. As a result, regular exercise has been linked to improved cognitive function and a reduced risk of age-related cognitive decline. Furthermore, exercise has been shown to have a positive impact on brain function in people of all ages, including children and older adults. Studies have shown that regular exercise can improve academic performance and cognitive function in children, as well as reduce the risk of cognitive decline in older adults. 2. Getting enough sleep. Getting enough sleep is essential for optimal brain function. When we sleep, our brains go through different stages of sleep, including rapid eye movement, REM, and non-REM sleep. During REM sleep, our brains consolidate memories and process information. This means that getting enough sleep is crucial for improving our cognitive function, memory, and concentration. Studies have shown that lack of sleep can have serious negative effects on our brain function. In one study, participants who were sleep-deprived for 24 hours showed decreased performance on cognitive tasks, including memory, attention, and reaction time. Other studies have found that chronic sleep deprivation can lead to structural changes in the brain, including a decrease in gray matter volume, which is important for cognitive function. In addition to cognitive effects, lack of sleep can also have negative effects on our mood and mental health. Sleep deprivation has been linked to increased anxiety, depression, and irritability. It can also lead to decreased motivation and productivity, making it difficult to perform well in our daily tasks. 3. Staying hydrated. Water is essential for our body to function properly, and our brains are no exception. In fact, the brain is one of the most water-dependent organs in the body, and even a slight dehydration can affect our brain function. When we become dehydrated, the blood volume in our body decreases, which means less oxygen and nutrients are being transported to our brain. This can cause a variety of symptoms like headaches, fatigue, and difficulty concentrating. Studies have shown that even mild dehydration can affect our cognitive function. In one study, participants who were dehydrated had more difficulty performing tasks that required attention, memory, and motor coordination. In another study, young adults who were mildly dehydrated experienced difficulty with cognitive tasks like mental arithmetic, short-term memory, and reaction time. So how much water do we need to stay hydrated? The amount of water we need can vary depending on a number of factors like our age, weight, and activity level. The general recommendation is to drink at least 8 cups, 64 ounces, of water per day, but some people may need more or less than that. 4. Eating a healthy diet. Eating a healthy and balanced diet is an important factor in maintaining good overall health and wellness. However, it is especially important when it comes to brain function. Our brains are highly metabolically active organs, and they require a constant supply of nutrients and energy to function properly. When it comes to brain-boosting foods, there are a variety of nutrients and compounds that can help to improve brain function. One of the most important nutrients for brain health is omega-3 fatty acids. Omega-3s are found in fatty fish like salmon, sardines, and mackerel, as well as in flax seeds, chia seeds, and walnuts. These fatty acids are crucial for the health of brain cells and have been shown to improve cognitive function and memory. Another important group of brain-boosting nutrients are antioxidants. Antioxidants help to protect brain cells from oxidative damage, which can lead to inflammation and cognitive decline. Some of the best sources of antioxidants include colorful fruits and vegetables like berries, leafy greens, and brightly colored peppers. In addition to omega-3s and antioxidants, there are several other nutrients that are important for brain health. These include B vitamins, which are important for energy production and nerve function, and magnesium, which is important for regulating neurotransmitters in the brain. On the other hand, it's important to avoid foods that can be detrimental to brain health. Processed foods, for example, are often high in sugar, unhealthy fats, and additives that can lead to inflammation and cognitive decline. Excessive sugar and caffeine can also be problematic, as they can cause energy crashes and brain fog. 5. Mental stimulation. Mental stimulation is one of the most important habits for boosting brain function. The brain is like a muscle. If you don't use it, you lose it. By challenging your brain regularly, you can improve your cognitive function, memory, and overall brain health. One way to keep your brain stimulated is by reading. Reading requires your brain to process information, visualize characters and settings, and make connections between ideas. It's like a workout for your brain, and it can help improve your vocabulary, comprehension, and critical thinking skills. Another way to challenge your brain is by doing puzzles. Puzzles require your brain to think creatively and problem solve. They can help improve your spatial reasoning, attention to detail, and memory. Puzzles can range from jigsaw puzzles to crossword puzzles, Sudoku, or even brain teasers. Playing games is also a great way to keep your brain sharp. Games like chess, Scrabble, or card games require you to think strategically, make decisions, and anticipate your opponent's moves. They can help improve your memory, concentration, and decision-making skills. Learning a new skill is another way to challenge your brain. Whether it's learning a new language, a new musical instrument, or a new hobby like painting or knitting, learning something new requires your brain to form new connections and pathways. This can help improve your cognitive function and memory, and also give you a sense of accomplishment and satisfaction. It's important to challenge yourself regularly in order to keep your brain in top shape. Make a habit of trying new things, whether it's reading a new book, trying a new puzzle, or learning a new skill. Your brain will thank you for it. So there you have it. 5 habits that can boost your brain power and help you perform better in your daily life. Before we go, we want to remind you to subscribe to our channel, Health, Fitness, and Nutrition, for more informative and entertaining videos like this one. Thanks for watching. Hello and welcome to Health, Fitness and Nutrition, the YouTube channel where we share useful tips and information on how to live a healthy and happy life. In today's video, we are going to talk about a very important topic, the early warning signs of breast cancer. Breast cancer is a type of cancer that develops in the breast cells and progresses in stages. It is one of the most common cancers among women, but it can also affect men. According to the American Cancer Society, about 1 in 8 women in the US will develop invasive breast cancer during their lifetime, and about 1 in 883 men will develop it as well. Breast cancer can be treated successfully if detected early, but sometimes it does not cause any symptoms until it is advanced. That is why it is very important to be aware of the changes in your breasts and to get regular screenings and checkups. So what are some of the early warning signs of breast cancer that you should look out for? Here are some of them. A new lump or mass in your breast or underarm. This is often the first and most obvious sign of breast cancer. The lump may feel hard, painless, and have irregular edges, or it may be soft, tender, and round. Sometimes, the lump may not be felt but seen on a mammogram. If you notice any new or unusual lump in your breast or underarm, you should see your doctor as soon as possible. Changes in the size, shape, or appearance of your breast. This may include swelling, shrinking, flattening, or dimpling of your breast. You may also notice that one breast looks different from the other. These changes may be caused by hormonal fluctuations, pregnancy, breastfeeding, or aging, but they may also indicate breast cancer. Changes in the skin of your breast or nipple. This may include redness, irritation, scaling, flaking, thickening, or puckering of the skin. You may also notice a rash or an orange peel texture on your breast or nipple. These changes may be signs of inflammation or infection, but they may also indicate a rare but aggressive type of breast cancer called inflammatory breast cancer. Nipple discharge or inversion. This means that fluid comes out of your nipple when you are not breastfeeding or pregnant. The fluid may be clear, bloody, yellow, green, or brown. It may come out spontaneously or only when you squeeze your nipple. Nipple discharge may be caused by benign conditions such as cysts, infections, or hormonal imbalances, but it may also indicate breast cancer. Nipple inversion means that your nipple turns inward instead of sticking out. This may be normal for some people who have always had inverted nipples, but if it happens suddenly or only on one side, it may be a sign of breast cancer. Pain in your breast or nipple. This means that you feel discomfort, tenderness, or soreness in your breast or nipple that does not go away. Pain in your breast or nipple may be caused by many factors such as menstrual cycles, pregnancy, breastfeeding, injury, infection, or mastitis, inflammation of the breast tissue, but it may also indicate breast cancer. These are some of the common early warning signs of breast cancer that you should be aware of and report to your doctor if you notice them. However, keep in mind that these signs do not necessarily mean that you have breast cancer. Many benign conditions can cause similar symptoms and most breast lumps are not cancerous. The only way to confirm a diagnosis of breast cancer is by doing a biopsy, removing a sample of tissue from the suspicious area and examining it under a microscope. Your doctor may also order other tests such as blood tests, ultrasound, using sound waves to create images of your breast, MRI, using magnetic fields to create images of your breast, or PET scan, using radioactive substances to show how your cells are functioning. The treatment for breast cancer depends on many factors such as the type and stage of the cancer, how far it has spread, the size and location of the tumor, mass, the characteristics of the cancer cells, such as hormone receptors and genetic mutations, your age and overall health, including whether you have reached menopause, and your personal preferences. The main types of treatment for breast cancer are surgery. Surgery is often the initial treatment for breast cancer and involves removing the tumor and surrounding tissue. The two primary surgical options are lumpectomy, also known as breast-conserving surgery. This procedure involves removing the tumor and a small margin of healthy tissue around it while preserving the rest of the breast. Mastectomy. In this procedure, the entire breast is surgically removed. Depending on the extent of cancer, a simple mastectomy or a modified radical mastectomy, removal of breast tissue, nearby lymph nodes, and sometimes the lining over the chest muscles, may be performed. Radiation therapy. Radiation therapy uses high-energy rays, such as X-rays or protons, to kill cancer cells and shrink tumors. It is often used after surgery to destroy any remaining cancer cells in the breast, chest wall, or nearby lymph nodes. Radiation therapy can be external, where a machine directs the radiation towards the affected area, or internal, where radioactive substances are placed inside the body near the cancer site. Chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells or prevent them from dividing. It is typically administered intravenously or orally, allowing the drugs to circulate throughout the body and target cancer cells wherever they may be. Chemotherapy may be used before surgery to shrink tumors, neoadjuvant therapy, or after surgery to eliminate any remaining cancer cells, adjuvant therapy. Hormone therapy. Hormone therapy is used when the breast cancer cells have receptors for estrogen or progesterone, which fuel their growth. This treatment involves the use of drugs that block the effects of these hormones or reduce their production in the body. Hormone therapy can be administered orally or through injections and is often prescribed for several years. Targeted therapy. Targeted therapy focuses on specific features of cancer cells that make them different from normal cells. These therapies use drugs that specifically target these unique characteristics, such as certain proteins or genetic mutations, to disrupt the growth and survival of cancer cells. Targeted therapies can be used alongside other treatments, such as chemotherapy or hormone therapy. Immunotherapy. Immunotherapy aims to stimulate the body's immune system to recognize and destroy cancer cells. It uses drugs that either enhance the immune response against cancer cells or block the mechanisms that prevent immune cells from recognizing cancer as a threat. Immunotherapy has shown promising results in some cases of breast cancer, particularly in certain subtypes. Some people may need only one type of treatment while others may need a combination of treatments. Your doctor will discuss with you the best treatment plan for your specific case. Breast cancer can be a scary and overwhelming diagnosis to face, but there is hope and help available. Many people survive and thrive after being treated for breast cancer thanks to advances in research and technology. You are not alone in this journey. There are many resources and support groups that can provide you with information, guidance, emotional support, practical assistance, and inspiration. We hope this video has been helpful and informative for you. If you have any questions or comments about this topic or any other health-related topic that you would like us to cover in our future videos, please leave them below. And don't forget to subscribe to our channel Health, Fitness, Nutrition for more videos like this one. Thank you for watching and stay healthy. Hi everyone, welcome to Health, Fitness and Nutrition, the channel where we share tips and tricks to help you live a healthier and happier life. In today's video, we're going to talk about the dangers of using your phone while it's charging. You might think that it's harmless to check your messages, browse social media or watch videos while your phone is plugged in, but you could be putting yourself and your device at risk. Here are some reasons why you should avoid using your phone while it's charging. 1. Overheating. Overheating is a significant danger associated with using your phone when it's charging. The process of charging causes the phone's battery to generate heat, and using the phone while it's charging can make it even hotter. The battery's temperature rises as it charges, and the phone tries to cool itself down by releasing the heat generated. If the phone is being used at the same time, the heat it generates can trap the heat from the battery, making it difficult for the phone to cool down, causing it to overheat. When your phone overheats, it can cause several issues, the most severe of which is battery leakage or explosion. Overheating causes the battery's chemicals to react, which could lead to the battery's contents leaking out, causing the phone to explode. In addition, overheating could cause the phone to switch off permanently. The battery will become damaged, and its performance will be significantly reduced, resulting in a shorter lifespan for your phone. Apart from the battery damage, overheating can also damage the internal components of your phone. Excessive heat can cause the phone's processor and other components to become damaged, leading to a decrease in the phone's performance. Furthermore, overheating can cause the phone to experience lagging, freezing, or crashes, and in severe cases, the phone could shut down permanently. To prevent overheating, you should avoid covering your phone with a blanket or pillow while it's charging. This could trap the heat generated by the phone and prevent it from cooling down. It's also essential to use a charger that is compatible with your device. Using a charger that isn't compatible could cause your phone to overheat as it tries to charge quickly. Using a certified charger and cable can help prevent overheating, as they are specifically designed to work with your phone and won't cause any harm to your device. 2. Electric shock. Electric shock is a severe hazard that can occur when using electronic devices, especially when they are connected to a power source. When your phone is plugged into a charger, it's in direct contact with an electrical current, and any contact with water or a faulty charger can result in an electric shock. If your phone falls into water while it's charging, the water can conduct electricity, and the current can flow through your phone and into your body, causing an electric shock. Electric shocks can cause severe injuries, including burns, muscle contractions, and even cardiac arrest. Similarly, a faulty charger can result in an electric shock. If the insulation on the charging cable is damaged, it can expose the wires, and the current can flow through the wires and into your body. This can also happen if the charger or the power outlet is faulty. It's important to ensure that you use only certified chargers and power outlets, and that you inspect your charging cable regularly for any signs of damage. Another potential hazard is lightning strikes during thunderstorms. Lightning can cause power surges that can damage electronic devices and result in an electric shock. It's important to unplug your phone during thunderstorms or when there is a power surge to reduce the risk of electric shock. To avoid electric shock, it's essential to be cautious when using your phone while it's charging. Avoid using your phone in the bathroom, kitchen, or near any water source when it's charging. Always unplug your phone before cleaning it or handling it near water. Additionally, be sure to use only certified charging cables and power outlets, and regularly inspect them for any damage. 3. Reduced battery capacity. When you use your phone while it's charging, you are creating a cycle of partial charges and discharges that can degrade the battery over time. Every time you use your phone while it's charging, the battery is simultaneously charging and discharging at the same time. This process causes the battery to work harder and generate more heat than normal, which can reduce its lifespan. Additionally, if you regularly use your phone while it's charging, you might notice that it takes longer to charge than usual. This is because the phone is using the power it's receiving from the charger to run its apps and other functions, which reduces the amount of power available to charge the battery. Over time, this can cause the battery's charging capacity to reduce, which means it will take longer to charge and will not hold a charge for as long as it used to. To preserve your battery capacity, it's essential to let your phone charge fully before using it. Once it's fully charged, unplug it from the charger and use it as normal. Avoid letting it drain completely or overcharge, as both of these can reduce the battery's lifespan. If possible, try to keep your phone's battery level between 20% and 80%, as this is the ideal range for the battery's health and longevity. Another way to preserve your battery capacity is to use a certified charging cable and adapter. Using a non-certified cable or adapter can cause the battery to charge too quickly, which can generate excess heat and reduce its lifespan. So, always use the cable and adapter that came with your phone, or purchase one from a reputable manufacturer. 4. Interference with other devices. Using your phone while it's charging can also interfere with other devices that are nearby, such as radios, TVs, or pacemakers. This is because when your phone is plugged in, it emits more electromagnetic radiation than when it's running on battery power. This radiation can cause static noise, distorted signals, or malfunctioning of other devices. To prevent interference, You should keep your phone away from other electronic devices while it's charging, and use a hands-free headset or speakerphone if you need to make or receive calls. As you can see, using your phone while it's charging is not only dangerous for you and your device, but also for other people and things around you. So next time you plug in your phone, resist the temptation to use it and do something else instead. You'll be safer, happier and healthier. Thank you for watching this video. If you found it helpful, please give it a thumbs up and share it with your friends and family. And don't forget to subscribe to Health, Fitness and Nutrition for more videos like this one. See you next time. Hello and welcome to Health, Fitness and Nutrition, the channel where we share tips and tricks to help you live a healthier and happier life. In today's video, we're going to talk about 13 of the healthiest foods you should add to your diet. 1. Avocado. Avocado is not only delicious but also incredibly nutritious. Its creamy texture and mild flavor make it a versatile ingredient in various dishes. Apart from being rich in healthy fats, avocados also provide essential nutrients like vitamin E, folate, and potassium. These nutrients contribute to heart health, skin nourishment, and brain function. Avocados are also a good source of soluble fiber, which aids in digestion and helps lower cholesterol levels. 2. Blackcurrants. Although small in size, blackcurrants pack a powerful nutritional punch. They contain more vitamin C and antioxidants compared to blueberries, making them an excellent choice for boosting your immune system and protecting your cells from damage. Additionally, blackcurrants have been shown to have positive effects on blood pressure and blood flow, making them beneficial for cardiovascular health. 3. Brussels sprouts. Brussels sprouts, part of the cruciferous vegetable family, offer a unique flavor profile that can be enhanced through various cooking methods. These mini cabbages are loaded with essential nutrients, including vitamin K, vitamin C, and folate. They also contain kaempferol, a plant compound known for its anti-inflammatory and anti-cancer properties. Incorporating Brussels sprouts into your diet can contribute to improved bone health, immune function, and overall well-being. 4. Buckwheat. Buckwheat, despite its name, is actually a seed rather than a grain. It serves as an excellent gluten-free alternative to wheat or rice. Buckwheat's distinct nutty and earthy flavor complements both sweet and savory dishes. This seed is particularly rich in protein, fiber, magnesium, phosphorus, and antioxidants such as rutin and D-chiro-inositol. These compounds play a role in regulating blood sugar levels and reducing the risk of diabetes-related complications. 5. Chia seeds. Chia seeds may be tiny, but they are packed with numerous health benefits. When soaked, they form a gel-like texture due to their ability to absorb water, making them a great addition to smoothies, oatmeal, yogurt, and other dishes. Chia seeds are an abundant source of calcium, magnesium, phosphorus, omega-3 fatty acids, and fiber. These nutrients are crucial for bone health, brain function, heart health, and maintaining a healthy digestive system. 6. Eggs. Eggs are often referred to as nature's perfect food due to their impressive nutritional profile. They contain all 9 essential amino acids, making them a complete protein source. Additionally, eggs are a rich source of choline, a nutrient vital for brain development and function. Lutein and zeaxanthin, 2 antioxidants found in eggs, contribute to eye health and protect against age-related eye diseases. 7. Kale. Kale has gained significant popularity as a superfood in recent years, and for good reason. This dark leafy green is low in calories but loaded with essential nutrients such as vitamin A, vitamin C, vitamin K, iron, calcium, and antioxidants. Incorporating kale into your diet can boost your immune system, help prevent anemia, support bone health, and combat oxidative stress. 8. Salmon. Salmon is a fatty fish that provides an abundant source of omega-3 fatty acids, EPA and DHA. These healthy fats are crucial for brain health, mood regulation, and reducing inflammation, triglycerides, and blood pressure. Salmon is also an excellent source of protein, selenium, vitamin B12, and vitamin D, all of which play important roles in metabolism, thyroid function, nerve function, and bone health. 9. Walnuts. When it comes to nuts, walnuts stand out for their exceptional nutritional content. They contain more omega-3 fatty acids than any other nut, making them beneficial for cognitive function, memory, and mood. Walnuts also offer advantages in terms of cholesterol management, blood pressure regulation, and protection against oxidative stress. Furthermore, they are a good source of fiber, protein, magnesium, copper, and manganese, which support digestion, muscle function, energy production, and antioxidant defense. 10. Yogurt. Yogurt, a fermented dairy product, contains live cultures of beneficial bacteria known as probiotics. These probiotics help maintain a healthy balance in your gut microbiome, which plays a crucial role in immune function, digestion, mood regulation, and weight management. Yogurt is also a good source of protein, calcium, potassium, and vitamin B12, all of which are essential for muscle growth, bone health, nerve function, and red blood cell production. 11. Quinoa. Quinoa is a gluten-free pseudo-grain that offers a unique texture and a complete protein profile. It contains all 9 essential amino acids, making it an excellent plant-based source of protein. Quinoa is also rich in fiber, iron, zinc, magnesium, and folate, all of which contribute to blood health, immune function, enzyme activity, and DNA synthesis. 12. Blueberries. Blueberries are not only delicious but also packed with antioxidants, earning them the reputation of being a superfood. These berries have one of the highest antioxidant capacities among fruits and vegetables, helping protect the brain from aging, improving memory and learning abilities, and reducing inflammation and oxidative stress. Including blueberries in your diet may also lower the risk of chronic diseases such as diabetes and heart disease. 13. Garlic. Garlic is a pungent herb that has been used for centuries both for its culinary and medicinal properties. Garlic contains a compound called allicin, responsible for its distinct smell and health benefits. Consuming garlic may help lower blood pressure, cholesterol, and blood sugar levels. It can also boost the immune system and possess antimicrobial properties against bacteria, fungi, and viruses. These are just some of the healthiest foods you should add to your diet, but there are many more out there that can nourish your body and mind. The key is to eat a variety of whole foods that provide different nutrients, colors, flavors, and textures. This way you can enjoy your food while improving your health. We hope you enjoyed this video and learned something new today. If you did, please give it a thumbs up and share it with your friends. And don't forget to subscribe to Health, Fitness and Nutrition for more videos like this one. Thank you for watching and we'll see you next time. Hello and welcome to Health, Fitness and Nutrition, the YouTube channel where we share tips and tricks to help you live a healthier and happier life. In today's video, we're going to talk about 8 foods you should never eat raw. You might be surprised by some of them, so make sure you watch till the end. Raw food diets are becoming more popular these days, as people believe that eating foods in their natural state can provide more nutrients and enzymes. However, not all foods are safe to eat raw, and some can even be dangerous or deadly. Here are 8 foods you should always cook before eating. 1. Potatoes. Potatoes are a staple food for many people, but eating them raw can cause bloating and digestive problems. That's because potatoes contain starches that are resistant to being digested, and can only be broken down by cooking. Raw potatoes also contain a toxin called solanine, which can cause nausea, vomiting, and even death in high doses. Solanine is more concentrated in green or sprouted potatoes, so make sure you avoid those altogether. 2. Rhubarb leaves. Rhubarb leaves, while visually appealing with their large, vibrant green appearance, contain a compound known as oxalic acid, which is highly toxic to humans and animals. This toxic compound is what makes the leaves unsuitable for consumption. Oxalic acid is a natural chemical found in many plants, including rhubarb. However, the concentration of oxalic acid in rhubarb leaves is significantly higher than in other parts of the plant. Consuming large amounts of oxalic acid can have severe health consequences. One of the most immediate risks associated with ingesting rhubarb leaves is the potential formation of kidney stones. Oxalic acid combines with calcium in the body to form calcium oxalate crystals, which can accumulate in the kidneys and lead to the development of painful kidney stones. This risk is particularly significant for individuals who are prone to kidney stone formation or have pre-existing kidney issues. Moreover, the consumption of rhubarb leaves can result in kidney failure, which is a serious and potentially life-threatening condition. The high levels of oxalic acid overwhelm the kidney's ability to process and eliminate it, leading to kidney damage and eventual failure. In extreme cases, the ingestion of large quantities of rhubarb leaves containing oxalic acid can even be fatal. It is crucial to exercise caution and avoid consuming these leaves under any circumstances. Additionally, oxalic acid in rhubarb leaves can hinder the absorption of essential minerals such as calcium and iron from other foods. This interference can be problematic for individuals who rely on a balanced diet to meet their nutritional needs. For those who cultivate rhubarb in their gardens, it is important to recognize the risks associated with the plant's leaves. To ensure safety, it is advised to remove and discard the leaves promptly after harvesting the stalks. This precautionary measure eliminates any possibility of accidental ingestion or contact with the toxic leaves. 3. Lima beans. Lima beans, scientifically known as Phaseolus lanatus, are a type of legume that is widely cultivated for its edible seeds. They offer several nutritional benefits, making them a valuable addition to a balanced diet. Lima beans are particularly known for their high protein and fiber content. Protein is essential for the growth, repair, and maintenance of tissues in our bodies, while fiber promotes healthy digestion and helps regulate blood sugar levels. However, it is important to be aware of a substance called linamarin that naturally occurs in lima beans. Linamarin is a glycoside, which means it is a compound made up of a sugar molecule attached to another compound. In the case of lima beans, linamarin is the glycoside attached to a compound called lot-ostrelin. Linamarin itself is not harmful, but when it comes into contact with an enzyme called linemerase, which is present in our digestive system, it can break down into hydrogen cyanide, HCN. Cyanide is a highly toxic substance that interferes with the body's ability to utilize oxygen, leading to cellular damage and, in severe cases, can be fatal. The key point to note is that the presence of linamarin and the potential formation of cyanide is not unique to lima beans. Many other plants, including cassava, flaxseed, bamboo shoots, and bitter almonds, contain similar compounds that can produce cyanide. However, the levels of linamarin in lima beans are relatively higher compared to some other foods. To mitigate the risk of cyanide poisoning from lima beans, it is crucial to ensure they are properly cooked. Cooking lima beans at a temperature of at least 70 degrees Celsius, 158 degrees Fahrenheit, deactivates the linemerase enzyme and breaks down linamarin, thereby eliminating the potential for cyanide formation. Boiling lima beans for a minimum of 10 minutes is recommended to ensure complete inactivation of linemerase and the breakdown of linamarin. 4. Red kidney beans. Another type of bean that can be harmful if eaten raw is the red kidney bean. Red kidney beans contain a toxin called lectin, which can cause severe vomiting, diarrhea, and abdominal pain. Lectin can also damage the intestinal lining and affect the immune system. To deactivate lectin, you need to soak red kidney beans overnight and boil them for at least 30 minutes. 5. Wild mushrooms. Mushrooms are a delicious and nutritious food that can add flavor and texture to many dishes. However, Not all mushrooms are edible. Some wild mushrooms are poisonous and can cause serious illness or death if eaten. Some of the most dangerous mushrooms include death cap, destroying angel, fly agaric, and false morel. Even if you think you know how to identify edible mushrooms from poisonous ones, it's not worth the risk. You should never eat wild mushrooms without consulting an expert. 6. Eggs. Eggs are a great source of protein, healthy fats, and essential vitamins and minerals. However, they can also harbor harmful bacteria such as salmonella, which can cause food poisoning if ingested. Symptoms of salmonella infection include fever, abdominal cramps, diarrhea, and dehydration. To prevent food poisoning from eggs, you should always cook them until the whites are firm and the yolks are cooked through. You should also avoid eating raw or undercooked eggs in dishes such as mayonnaise, cookie dough, or eggnog. 7. Hot dogs. Hot dogs are a popular snack or meal for many people, but they are not as safe as you might think. Hot dogs are pre-cooked before they are packaged and sold, but they can still become contaminated with bacteria such as Listeria during processing or storage. Listeria can cause serious illness in pregnant women, newborns, elderly people, and people with weakened immune systems. Symptoms of listeriosis include fever, muscle aches, headache, stiff neck, confusion, loss of balance, and convulsions. To prevent this, always reheat your hot dogs until they are steaming hot before eating them. Meat and poultry. This one might seem obvious, but it's worth repeating. Raw or undercooked meat and poultry can be very dangerous to eat. Raw meat and poultry can harbor harmful bacteria such as Salmonella, E. coli, Campylobacter, and Clostridium perfringens, which can cause food poisoning and serious infections. Symptoms of foodborne illness include fever, chills, diarrhea, vomiting, abdominal cramps, and dehydration. To avoid these risks, always cook your meat and poultry to the recommended internal temperatures, 145 degrees Fahrenheit for beef, pork, lamb, and veal, 160 degrees Fahrenheit for ground meats, and 165 degrees Fahrenheit for poultry. These are 8 foods you should never eat raw. By cooking them properly, you can enjoy their benefits without risking your health. We hope you learned something new from this video. If you did, please give it a thumbs up and subscribe to our channel for more health-related content. Thank you for watching Health, Fitness and Nutrition, and we'll see you next time. Hello everyone. Welcome back to our channel, Health, Fitness and Nutrition. In this video, we are going to talk about one of the most important aspects of staying healthy and fit, drinking water. Water is one of the essential components of life, and it plays a vital role in keeping our body functioning correctly. In this video, we will explain why drinking water is so important for our health. Firstly, let's talk about why drinking water is so important. Our body is made up of more than 60% water, and every cell, tissue, and organ in our body needs water to function correctly. Water is needed for a variety of bodily functions, such as regulating body temperature, transporting nutrients and oxygen to the cells, removing waste and toxins from the body, lubricating joints, and promoting healthy skin. In fact, dehydration can lead to a host of health problems, including fatigue, headaches, constipation, and even kidney stones. Water is also crucial for maintaining a healthy weight. When we drink water before meals, it can help reduce our appetite and calorie intake, which in turn can aid in weight loss. This is because drinking water before a meal can create a feeling of fullness, which can prevent us from overeating. When we drink water before a meal, we are also less likely to consume sugary or high-calorie drinks that can contribute to weight gain. In addition to reducing appetite, drinking water can also help boost metabolism, which can further aid in weight loss. When we are dehydrated, our metabolism slows down, which can make it harder for us to burn calories. By drinking water, we can help keep our metabolism functioning optimally, which can increase the number of calories we burn throughout the day. Several studies have been conducted to investigate the effects of drinking water on weight loss, and the results have been promising. One study published in the Journal of the Academy of Nutrition and Dietetics found that people who drank water before meals lost more weight than those who didn't. The study followed 84 adults who were overweight or obese and found that those who drank 16 ounces of water before meals lost an average of 9.48 pounds over 12 weeks, compared to an average weight loss of 1.76 pounds for those who didn't drink water before meals. Another study published in the journal Obesity found that drinking 500 milliliters of water before a meal can increase metabolism by up to 30%. The study followed 14 participants and found that drinking water before a meal led to an increase in energy expenditure, or the number of calories burned, compared to not drinking water before a meal. It's important to note that while drinking water can be an effective tool for weight loss, it's not a magic solution. Drinking water is also essential for maintaining good digestive health. When we consume food, it goes through a complex process of digestion and absorption in our body. Drinking enough water is crucial for this process to occur efficiently and effectively. Water helps to break down the food we eat into smaller particles, making it easier for our body to absorb the essential nutrients from the food. Moreover, water plays a critical role in maintaining regular bowel movements and preventing constipation. Constipation is a common digestive problem that occurs when stool becomes hard and difficult to pass. It can cause discomfort, bloating, and even lead to more severe problems such as hemorrhoids. Drinking enough water is essential to help prevent constipation because it keeps the stool soft and adds bulk to it, making it easier to pass. When we are dehydrated, the large intestine absorbs water from the stool, making it harder and more challenging to pass. This is why it's crucial to drink enough water to keep our digestive system healthy and our bowel movements regular. So, how much water should you be drinking? The recommended amount of water varies depending on factors such as age, sex, weight, and activity level. As a general guideline, adults should aim to drink at least 8 glasses of water a day, or about 2 liters. However, if you are physically active, pregnant, or breastfeeding, you may need to drink more. It's also important to remember that water intake isn't just limited to drinking water. Foods such as fruits and vegetables also contain water and can contribute to your daily water intake. Foods such as watermelon, cucumbers, and celery are particularly high in water content and can help keep you hydrated. Now that we know why drinking water is so important, let's talk about how you can make sure you stay hydrated throughout the day. Here are some tips. 1. Carry a water bottle with you. This will make it easier to stay hydrated throughout the day, as you can sip water whenever you need it. 2. Set reminders. If you have trouble remembering to drink water, set reminders on your phone or computer to remind you to drink water at regular intervals throughout the day. 3. Drink water with meals. Drinking water with meals not only helps with digestion, but also helps you feel fuller, which can help with weight loss. 4. Flavored water. If you don't like the taste of plain water, try adding fresh fruit or herbs to your water for a flavorful twist. 5. Limit alcohol and caffeine intake. Alcohol and caffeine can cause dehydration, so it's important to limit your intake of these beverages and make sure to drink water alongside them. In conclusion, drinking water is crucial for maintaining good health. It's important to drink enough water each day to keep our bodies functioning correctly, and there are many ways to make sure you stay hydrated throughout the day. Remember to carry a water bottle with you, set reminders, drink water with meals, flavor your water, and limit your alcohol and caffeine intake. Thank you for watching this video, and if you found it helpful, please give it a thumbs up and subscribe to our channel, Health, Fitness, and Nutrition, for more health and wellness content. Hello and welcome to Health, Fitness and Nutrition, the channel where we share tips and insights on how to live a healthier and happier life. In today's video, we are going to talk about why constant smartphone use is bad for your health and what you can do to reduce your screen time. Smartphones are amazing devices that allow us to communicate, access information, entertain ourselves, and perform many other tasks. However, they also come with some drawbacks that can affect our physical and mental well-being. Here are some of the negative effects of excessive smartphone use on your health. 1. Cell phone radiation. Cell phone radiation has been a subject of concern for many years. According to the World Health Organization, WHO, cell phone radiation falls under the classification of a possible carcinogen, which means it has the potential to increase the risk of certain types of cancer. While the evidence regarding this link is not definitive, several studies have suggested a potential association between cell phone radiation and the development of tumors. One specific concern is the possible connection between cell phone radiation and brain tumors. Some studies have reported an increased risk of glioma, a type of brain tumor, among heavy cell phone users. The proximity of the phone to the head during conversations, coupled with the radiation emitted, has raised concerns about potential long-term effects. It's important to note that research in this area is ongoing, and the overall scientific consensus has not firmly established a causal relationship between cell phone radiation and brain tumors. Another area of concern is the potential link between cell phone radiation and salivary gland tumors. The salivary glands, located in the head and neck region, may be exposed to radiation during prolonged cell phone use. While studies investigating this relationship have yielded mixed results, some research suggests an increased risk of salivary gland tumors, particularly on the side of the head where the phone is commonly held. Apart from the potential cancer risks, cell phone radiation may also interfere with certain medical devices. For example, individuals with pacemakers or implanted cardiac devices should be cautious when using cell phones, as the electromagnetic fields emitted by the devices could potentially disrupt the proper functioning of these medical implants. Similarly, hearing aids may experience interference when in close proximity to cell phones, leading to reduced sound quality or other malfunctions. 2. Changes in brain activity. Numerous studies have raised concerns about the potential impact of cell phone use on brain activity. Research has shown that using a phone while it's charging can lead to alterations in brain waves, reaction times, and cognitive functions. These changes in brain activity are primarily attributed to the electromagnetic fields, EMF, emitted by mobile devices. One notable study investigated the effects of prolonged cell phone use on brain metabolism. The researchers discovered that individuals who used their phones for more than 50 minutes exhibited increased glucose metabolism in the brain region closest to the antenna. Glucose metabolism is an indicator of brain activity, suggesting that prolonged cell phone use can affect the functioning of the brain in that specific area. However, it's important to note that the long-term implications of these observed changes in brain activity are still uncertain. Further research is needed to fully understand the potential consequences. 3. Sleep problems. Using your smartphone before bed or during the night can disrupt your sleep quality and quantity. The blue light emitted by the screen can suppress the production of melatonin, a hormone that regulates your circadian rhythm and helps you fall asleep. Moreover, checking your phone for messages, emails, or social media can keep your mind alert and prevent you from relaxing. Poor sleep can lead to fatigue, mood swings, impaired memory, and increased risk of chronic diseases. 4. Mental health issues. Excessive smartphone use can also affect your mental health in various ways. For instance, it can cause anxiety, depression, obsessive-compulsive disorder, OCD, attention deficit hyperactivity disorder, ADHD, and alcohol use disorder. It can also impair your ability to regulate your emotions, control your impulses, and cope with stress. Furthermore, it can reduce your social skills, self-esteem, and happiness by making you compare yourself to others or feel isolated. 5. Physical health problems. Spending too much time on your smartphone can also harm your physical health by reducing your physical activity, fitness, and healthy eating habits. It can also cause pain and discomfort in your eyes, neck, back, shoulders, wrists, and fingers due to poor posture and repetitive movements. Additionally, It can increase your risk of accidents and injuries by distracting you while driving or walking. As you can see, constant smartphone use is bad for your health in many ways. But don't worry, there are some simple steps you can take to reduce your screen time and improve your well-being. Here are some tips. Set limits. Decide how much time you want to spend on your phone each day and stick to it. You can use apps or settings that track your usage and block certain apps or notifications after a certain limit. You can also turn off your phone or put it on airplane mode when you don't need it. Schedule breaks. Take regular breaks from your phone throughout the day. For example, you can leave it in another room while you eat, work, study, or exercise. You can also set a reminder or an alarm to remind you to take a break every hour or so. Avoid using your phone before bed. Stop using your phone at least an hour before bedtime. Instead of scrolling through social media or watching videos, do something relaxing like reading a book, listening to music, meditating, or taking a bath. You can also keep your phone out of your bedroom or use a separate alarm clock to wake up. Engage in other activities. Find other hobbies or interests that don't involve your phone. For example, you can learn a new skill, join a club or a class, volunteer for a cause, or spend time with friends and family. These activities will enrich your life and make you less dependent on your phone. Seek professional help. If you feel that you have a problem with smartphone addiction or that it is affecting your health significantly, don't hesitate to seek professional help. You can talk to your doctor, therapist, counselor, or a support group who can help you overcome your addiction and improve your well-being. We hope you enjoyed this video and learned something new. If you did, please give it a thumbs up and share it with someone who might benefit from it. And don't forget to subscribe to our channel for more videos on health, fitness and nutrition. Thank you for watching and see you next time. Hi everyone, welcome back to Health, Fitness and Nutrition, the channel where we share tips and advice on how to live a healthy and happy life. In today's video, we're going to talk about the top 10 foods to eat when you are pregnant. Pregnancy is a special time in your life, and you want to make sure you and your baby get all the nutrients you need for a healthy development. But with so many food choices out there, how do you know what's best for you and your baby? Well, don't worry, we've got you covered. Here are 10 super nutritious foods that you should include in your pregnancy diet. 1. Dairy products. Dairy products are rich in protein, calcium, phosphorus, B vitamins, magnesium, and zinc. These are all essential for your baby's growth and development, especially for their bones and teeth. Dairy products also contain probiotics, which are beneficial bacteria that support your digestive health and immune system. You can get dairy products from milk, cheese, yogurt, and kefir. Try to choose low-fat or fat-free options to limit your intake of saturated fat. 2. Legumes. Legumes are plant-based foods that include beans, lentils, peas, chickpeas, soybeans, and peanuts. They are great sources of fiber, protein, iron, folate, and calcium. Fiber can help prevent constipation and hemorrhoids, which are common during pregnancy.